nursing documentation is probably one of the bedrocks of looking at any patient. When we review data of any patient, I think so nursing documentation has been the bedrock of it. Being a doctor, I can just when I don't have any hesitation in sharing that sometimes the doctor documentations, medical documentation is not as appropriate as nursing documentation is there. So while we discuss this, I think so today we have a stellar panel of 4 senior members from the healthcare sector. So it will be interesting to see, and we'll interact and we'll hear their opinion on what all to do going forward and on the nursing documentation as we look at it, the rational essential documentation for effective patient care. So what I'd like to say is that what is the basic purpose of documentation? The primary purpose is obviously to facilitate information flow that supports continuity, quality, and safety of the patient. And with it, attendant things are always there, like accreditation, accountability, legal requirements, the financial part. But overall, the most fundamental thing is patient care. How do we plan for care? How do we hand over? How do we ensure that if you look at as time has progressed in the healthcare sector, nursing has been burdened with a lot of documentation, lot of paperwork. So I think so this it will be a good thing to sort of brainstorm on what to do and how do we reduce their paperwork and not slow the productivity. And I'd like to just go to Ms. Josephine is on the handover, because we have seen in our practice that handover is a very crucial part of any thing that as far as the quality of care of the patient is concerned. So a lot of times we sometimes don't have a proper handover, and that is where we slip up. So I would like to request Ms. Josephine to sort of enlighten the audience on what is the best way to hand over, so that as we are discussing, patient care is central and we can enhance patient care. Over to you, ma'am.
See, today, during this time when the healthcare is a very complex, it's a complex scenario. And nursing documentation and nursing handover is the need of the hour. Now, with NABH, JCI, and the Nursing Excellence Accreditation in place, handover is getting lot of momentum these days. And personally, I can say, for the first time in the past 2 years, we had implemented a lot of training activities concerning effective handover. And with my long experience, I have seen that, there are so many methodologies available for handover. But for nurses, even for doctors, for everyone, the best method what we teach and we practice is ISBAR handover. Now, before I talk about ISBAR handover, let me tell you, we talk about handover, but to implement handover and to make it happen successfully, from the time of nursing induction itself, nurses have to be sensitized about the very importance of effective handover and what is the method that we follow at the institution and how it is relevant to patient care, clinical outcome, and patient satisfaction. And also, this is also very, very important when it comes to accreditation compliance, which also helps in patient safety. So today we have taken it as a, many organizations I have seen it, they have taken it as a quality improvement project. People have done quality improvement studies, clinical studies, and better outcomes they have achieved. Now, to give complete handover at the bedside, nurses have to, as Dr. Gracie has told, young nurse, a fresh graduate or an experienced nurse has to be totally aware of the patient. And today nurses document hard copy documentation. Some organizations have huge list of documentation. Some have, reduced the amount of documentation you can manage. And also there is mobile-based documentation, the latest I see, and the system-based documentation. And of course, the patient-based documentation. So when you hand over, you have to first consider. So I always teach my nurses, first is the patient connection. The methodology can be SBAR. You talk about, you introduce yourself, you talk about the patient identity and the situation and what was the background What is your assessment finding for the day, and what's the recommendation which the clinician has recommended and you think of to be done in this shift to continue with the continuity of care. So the best is nurses have to be totally aware of the case. So as Madam Gracie said, today they do a whole list of documentation, but the assessment of the patient has to be complete. And that is where still there is a lot of lacunae when it comes to nursing assessment. There are so many assessment formats available today. If our assessment is complete and if we have excellent communication and interaction with the patient, it's a whole database that is with us. So when we go to the patient, the best form of handover is at bedside. At bedside, along with our incoming nurse and talking to the patient with a beautiful smile, and then briefly telling everything in detail at bedside, what is permissible, what we can discuss. That's such a pleasant experience, which I experienced. Even I worked with so many nationalities in Saudi Arabia. I have seen that the medical management was so particular about bedside handover first. Next comes, you come back to the counter, you can talk about something personal, something which you do not want to discuss at a bedside, but you follow the same methodology of ISBA. Now comes your assessment. What did you do in the shift? What was the assessment of the patient findings when you came? During the course of the day, what happened? And then any procedures, any other activities has happened? Any issues from the patient side? Anything good, anything bad? How was the clinical rounds? What was the experience? And what is the plan for discharge? Everything you discuss, the current. So the background you have discussed, the current you have discussed, and then comes the recommendation. So the recommendation, many times we nurses, we tend to forget, something or other when we are busy with the handover or they are in hurry to go, or the nurse patient ratio is so poor. So in that case, they have to finish all the work and then push off. So many times, even though we talk in this forum about ISBAR and the detailed handover, sometimes that doesn't happen. But still, nurses try to make it and they talk about all the recommendations. But where they have to concentrate is the first and most important handover is your patient at bedside. So the patient understands my nurse who has done the duty from 8 a.m. to 2 p.m. is leaving now. My incoming nurse is here. She is so-and-so or he is so-and-so. And they are discussing about me if he is a conscious patient. And always involve the patient and patient family. And that's something, participation of patient and patient family gives you immense respect and personally a professional satisfaction. And acknowledging the care what you delivered, and very nicely you will come to know from there. See, communication is always verbal and non-verbal. You will come to know how the family is feeling. Are they happy? And you will also come to know, for your information, many times a fearful nurse might not have reported an error which has happened at bedside, but during a bedside handover, the patient or patient family might share with you. So a lot of learning. And then comes the system-based handover. Quickly click the system, and today the system, the HIS documentation is so efficient. And if you have the mobile-based documentation, everything can be shown at bedside. And then you discuss about what's the future plan is all about. So to conclude, handover is such a beautiful experience. Handover is somewhere you should feel proud about what you have done and what you have accomplished. When you came, your patient was depressed. I'll quickly tell you one example. I had experience of a young girl who didn't want to continue her life. She was so depressed. She was shattered. She was only 17 and she was not getting any love and affection at home. But my nursing assigned staff could handle her so well. By the end of the shift, she's so happy. She's so pleasant, so charming. So it is patient care is not only about medications. It is not only about various therapeutic procedures. It is about kind words. I remember one of my previous chairman, he told me, care is about that extra 5 minutes at bedside, maybe by physician, maybe by the nurse. That patient want to tell you something extra, and you give a listening ear. That's all about a handover. And then you come back and you share the hard copies and the system and everything, and a goodbye to the team. That's all.
Thank you, ma'am. Thank you.